Earlier today, we announced further restrictions to stop the spread of COVID-19. Effective today at midnight, all bars and restaurants will be only permitted to remain open until midnight. All adult entertainment clubs will be closed right across the province. All businesses and organizations will be required to implement screening procedures for their workers. And tomorrow, going forward, restaurant and bars must stop serving alcohol at 11 p.m. and close their establishments by midnight, except takeout service or delivery. I just want to repeat that again. Tonight, they close at 12 o'clock midnight. Tomorrow, they stop serving alcohol at 11 p.m. and close their doors at midnight.
This is going to be coming as a surprise to a lot of those in the bar and restaurant industry, the decisions that you guys made today. You've been saying for a while now that bars and restaurants aren't really the problem. So I'm just trying to figure out what changed. When did bars and restaurants and these hours become an issue, and what specifically was the problem that necessitated this action today?
Well, I want to, again, say I think the vast majority of restaurant owners, they have been responsible. There has been outbreaks with staff members in that. It's precautionary. We have to be careful, and I don't think it's unreasonable that the chief medical officer has requested that especially the nightclubs that we've seen outbreaks in a few nightclubs. I don't think it's the end of the world. People stop drinking at 11 and close it down at 12 o'clock. It's precautionary measures moving forward. It won't be forever, but I agree with it. Plus, on top of that, we have Mayor Tory was concerned. Other mayors, regional mayors in the GTA have asked me to do this. We had the mayor in London asked me to do this. So there's quite a few mayors concerned, along with the local chief medical officers. It's just another step that we can put in place that will slow down the spread of COVID.
Follow up?
Thank you. And just on that, you guys see modeling data on a regular basis. Is there any modeling data that shows what the impact or the potential impact of these specific measures could have in the days and the weeks to come?
Yes, and I've always said, Colin, I did get briefed yesterday. We'll be rolling out the modeling next week. So what I've seen, we're going to roll it out next week, and the people can see it at all as well. And there's different scenarios.
Next question
will be from Sean Jeffords at the Canadian Press. Please go ahead.
Hi, Sean.
Hi, Premier. Wanted to ask you today about the decision to change the rules around bars and restaurants and follow up a bit on what Colin just asked there. When it comes to the rules, you were pretty strident earlier in the month that the municipalities really had the say here, that they could go out and make these changes if they need to do that. What has changed your mind? Is it just the rates, or is there something else here that has helped, I guess, if you're thinking on this?
Well, I think it's an influx of cases. As the minister said, we've seen doubling of cases in a very short period of time, and it's very, very concerning. And as for the restaurants, I'll stand up for the restaurants. These people are hurting. They're holding on by the end of their fingertips, and in the restaurants that I've went into, they're following the procedures and protocols. But there's not too many people that are having dinner past 12 o'clock at night. We're still going to keep the takeout and delivery services open, and the nightclubs have been concerning. We've heard it on the news. There's been outbreaks, and we just can't chance it. We really can't. We're seeing the numbers that are basically under the age of 40, 39 and under, and then those are the highest numbers. And I can tell you, I don't see seniors going into nightclubs too often. It's usually that age group that are going in there, and God bless them. Be careful, have face coverings, but we just can't have these places open till 3 o'clock in the morning. But we're being very balanced. I feel very, very balanced, and so is the chief medical officer and the health team. They're very pragmatic. They understand the economy is very important, as it is to us. But number one is the health and safety of the people of Ontario.